Welcome to Healthcare and You, your questions answered. I'm Danielle Knox. In 2014, many Americans, especially the newly insured, may wonder how healthcare reform affects them as a patient. We are talking to some of the nation's leading experts to help you understand how to navigate this new world of healthcare and receive high-quality care. Welcome Sandy Sosa Guerrero from Larkin Community Hospital and Linda Quick from the South Florida Hospital and Healthcare Association. Thank you both for joining us. So I want to begin with this. Are patients' rights going to be affected under the Affordable Care Act?
Actually, they're improved. Patients have always had rights to privacy, rights to care and treatment in a respectful manner. Now they also have the right to have health insurance and health care coverage to pay for that treatment.
You know, pre-existing conditions has really been the big talk, as I'm sure you know. What does the Affordable Care Act mean for patients who have pre-existing conditions? Will they be able to get coverage?
Actually, it guarantees them coverage. And this is extremely important. People with pre-existing conditions always lived in fear of transferring jobs, transferring insurances. Now they don't have to worry about that any longer.
How does the Affordable Care Act impact, let's say, preventive services like routine wellness exams and vaccinations?
The good news is those are part of the 10 essential benefits. So wellness checkups and mammography and colonoscopy and early childhood screening are all part of your insurance package now.
So as people navigate these waters and they begin to choose their coverage, when they are choosing coverage, how important is it that people look for insurance plans that kind of have incentives for staying healthy?
It is very important. As a hospital, we don't want to see you when you get ill. We want you to be able to see your doctor before, receive preventative care, wellness programs, and then if you happen to be ill, then of course come to the hospital.
And that was going to bring me to my next question. What steps can patients take to ensure that they are receiving quality health care?
Well, the first is to communicate. It is really important to have conversations with your physicians. And people with chronic conditions, things like high blood pressure, diabetes, they need to be taking their medication. They need to, with those patient rights come some responsibilities, and some of those responsibilities are to follow doctor's orders.
What factors then should patients consider when they are making decisions about health plans?
There's no cookie cutter approach. You're going to have to look at your conditions. You need to know what histories you have, and then you need to go to the websites and select the best plan for you and your family.
Good advice. Thank you so much, Sandy. Thank you, Linda, and thank you for watching. Healthcare and You, your questions answered. Get informed to make important healthcare decisions.